Aloha Kauai. Here's our daily COVID-19 briefing from Team Kauai for Wednesday, June 24th. As of 9 a.m. this morning, we have confirmed 4 additional positive cases, bringing our total number of active cases to 12. Kauai's cumulative total of cases to date is now 33. These new cases will be reflected in the state's daily count tomorrow at noon. All of the active cases are in isolation, and all other household members and identified close contacts of the active cases are in quarantine. The 4 new cases reported this morning are part of the same household, but a separate household from the cases announced last week. These new cases were identified by the Department of Health as close contacts of the original household and were therefore tested earlier this week. They have been in quarantine since they were identified as close contacts. This emphasizes the need for anyone under quarantine to strictly follow their quarantine instructions, even if your initial test results come back negative, as we know that you could develop symptoms at any time during the incubation period of 14 days. Our Kauai District Health Officer, Dr. Janet Berman, is here to give us more details on how this works.
Okay. Mahalo, Mayor. As the Mayor mentioned, we have 4 positive new test results. All are part of a single household, which is separate from the household of the previous 8 cases. The 4 new cases, 1 adult and 3 children, are in isolation and their family members are in quarantine. All of the current active cases, that's 12 of them in all, are either mildly ill or asymptomatic. So far, no one has required hospitalization. These new cases were identified through our ongoing contact tracing, and we continue that process. As a result of our contact tracing, we are continuing to identify, test, and quarantine additional contacts. We expect to continue to receive test results over the next few days. We get a lot of questions about where this latest Kauai outbreak originated. We continue to investigate the possible source of this infection, in particular whether there may be a link to travel. Thus far, we have no definite indication of a travel source, but we are actively pursuing all leads, and we'll keep you posted. We also get questions about the difference between isolation and quarantine, which may superficially appear similar. In both cases, families or individuals are separated from others, either in their home or in an alternative location. They're directed not to leave the place of isolation or quarantine and not to receive any visitors. Quarantine is for those who have been exposed and therefore are at risk of becoming ill but are not currently ill. They must not leave their place of quarantine or receive guests during a 14-day period from their date of exposure. Most of those in quarantine are now being tested early in the course of their quarantine. That's how our new cases have been identified. But a negative test does not ensure that an individual won't become sick or turn positive during the remainder of their quarantine. So a negative test does not shorten the duration of the quarantine. Isolation, while it looks the same, is for people who we know are sick with COVID-19 and must be kept apart from people who are not infected. The duration of their isolation depends on the course of their illness. It can be shorter or longer than quarantine. For those who need to be hospitalized, their isolation continues in the hospital. Once again, our ongoing outbreak has active cases of illness in 2 households, and our health department teams are continuing our investigation and are monitoring dozens of individuals in our island community who are in quarantine, as well as the 12 who are in isolation. Mahalo.
Thank you, Dr. Berman, for that detailed explanation. We will continue to provide updates as new information becomes available. Lastly, today we'd like to update you on the Emergency Rental Mortgage Assistance Program that we announced last week. The county provided $400,000 to offer a rental, mortgage, and utility assistance program to residents in need as a result of the pandemic. The County Housing Agency teamed up with Malama Pono and the Family Life Center to accept and process applications. We had an overwhelming response and are no longer accepting new applications at this time, as we are currently processing the current applications. If additional funding becomes available, we will reopen the application process to the public. Folks, as we said all along, we knew it was not a matter of if, but when this virus would return to our island, and we can expect to see our case numbers continue to rise. Containing the spread and minimizing our risk and exposure is up to every single one of us. we all have a responsibility to keep ourselves and each other safe. We can do that by following these simple steps. Stay home as much as possible. Refrain from social gatherings or public outings. If you must interact with people outside of your home, maintain a distance of 6 feet of separation and wear a mask, if at all possible for you to do so. Remember, my mask protects you and your mask protects me. It's a sign of respect and aloha. Do not leave home if you are sick unless you're seeking medical attention, and then only after calling your doctor first. Wash your hands frequently and clean surfaces often. Stay informed and connected during this time of social distancing. We'll continue to post updates on our official County of Kauai Facebook page or on our Kauai Emergency Management Agency page at www.kauai.gov/COVID-19. The Centers for Disease Control is also updating its website regularly. For more information, please visit coronavirus.gov. Not everyone has internet access or follows the news, so please help to keep your loved ones informed. Be kind, take care of one another, God bless, and aloha.